Hello, I'm Nick the nurse. Today we're going to be talking about the duty to warn and protect others as it applies to confidentiality in an inpatient or even outpatient mental health facility in the nursing field. It's really, well, let me just give you an example right off the bat that'll clearly demonstrate this concept. Unfortunately, we've had quite a few school shootings that have occurred in the last couple of years, and there have been issues where there have actually been psychiatrists at some of these schools. I think in the Virginia Tech shooters case or one of these other shootings, where a psychiatrist actually evaluated a student who later went on to shoot other patients or other students. And what happened is that the psychiatrist had a duty to warn others and to protect others against any harm that might result from mental health patients' dangerous thoughts. You know, there's nothing against the law about thinking certain things. Okay, if you want to rob a bank, for example, it's not against the law to think about robbing a bank, but it is against the law when you start to tell somebody else about robbing a bank, or it is against the law in this particular case, or it's something that's reportable when you tell your psychiatrist or psychologist or even the nurse that you're going to go, bomb a building or go rob a bank. These are things that we have a duty as nurses. Okay, those who have passed the NCLEX to go out and actually and tell other people. So, for example, if you had a patient who said that there were demons that were telling him to go and rob a bank down the street at 12 o'clock noon on Sunday, you as a mental health professional, as a nurse, would have a duty, an obligation even, legally. And again, I'm not a lawyer and can't give legal advice, but you would have a legal obligation to go and warn the people, or at least call the police so something like that wouldn't happen. That's part of our duty as nurses. And you'll be a nurse too with that duty after you pass the NCLEX. At any rate, just remember that. Best of luck on your nursing school exams and on the NCLEX, and we'll see you next time.